Whether it's a scheduled procedure or an emergency, when you arrive at the hospital, there are dedicated healthcare workers ready to help. And when it comes to nurses, many are working extra hours, some even double shifts to cover the gap that is only widening as their colleagues retire or simply decide they've had enough. Regina McKinney is one of those dedicated professionals. As an advanced practice registered nurse, she's had an opportunity to mentor and speak to young people about her profession. And when she was out there, she noticed something.
I just didn't see students that looked like me. So I had an interest in what was keeping these minority students from nursing. So that was one of the reasons why we developed Nursing Cap Incorporated.
That was 2013. Over the last 8 years, Nursing Cap has touched the lives of hundreds of middle and high school students, tutoring them in the courses they'll need, training them with equipment like blood pressure monitors and stethoscopes, and introducing them to medical professionals who'll share their day-to-day reality and who don't mind sharing the road they traveled to get there.
So I worked as a pharmacy cashier first, and then I did a pharmacy technician, and then I went back to pharmacy school and graduated in 2018. After pharmacy school, I did a pharmacy residency, which was ridiculously competitive.
We have a real concern regarding a focus on those middle school years because we realize that those are the most formative years for students to have an interest in these careers. And we know that if we can get them early on to develop science and math concepts, then they will have a greater chance to be successful in nursing and healthcare careers in general.
Maya Miltier entered the program when she was 15. Reflecting back, she says she really enjoyed the college tours that Nursing Cap provided.
But I liked Columbia University. They were very friendly. I also went to Emory College, Clark, Spelman. We got to go on tours, and I liked different programs they had for medical students, and I liked how they accommodate you.
She's now 19, attending Tidewater Community College with her sights set on entering the nursing program at ODU or NSU.
What inspired me to be a nurse was when this lady, she came in and she was a nurse navigator, and I liked hearing about her career, and she told us about what they do daily, takes control of all of the patients' files and everything. They basically are like head of nurses. So that kind of inspired me to be a nurse.
And while the pandemic has caused some nurses to call it quits earlier than experts predicted, it hasn't swayed the majority of Nursing Cap program participants.
Believe it or not, they still want to go into nursing. They're telling us that they really know that nurses really have been the backbone of the healthcare system.
A system that is hungry for nurses of color.
We're going to definitely need diverse healthcare professionals to take care of the increased minority population that we have. As a nurse anesthetist, when I see patients that are African American and I tell them that I'm going to be with them during their surgery, they are better able to relate to me. They could be stressed about having this surgery, and then all of a sudden when I tell them that I'm going to be with them throughout the surgery until they wake up, that lessens their anxiety about going under and having surgery. I definitely know that having a diverse healthcare workforce, doctors, pharmacists, dentists, and other healthcare providers can certainly help with the healthcare disparities that exist.
For Another View, I'm Lisa Godley.